I grew up in a pharmacy. My father was a pharmacist and my older sister. So I grew up as a child working in retail pharmacy. We heard testimony tonight about your interest in expanding the scope of practice. How would you take into account the needs of senior citizens, which is very important in my district here on the Upper East Side and on Roosevelt Island? And I want to also encourage early hours be reserved for senior citizens in order to reduce their waiting time, especially in this pandemic.
So who's that question to?
Any member that would like to answer it.
Okay.
Maybe I can start and you can
Go ahead.
finish up.
Sure, Mike.
Great. So thank you very much for the question. You know, I think there's a lot that we've learned just recently with this pandemic, from finding new ways to schedule the COVID vaccine. Also, a lot of these scope of practice expansion proposals really are focused on the elderly population. For example, CDTM, and allowing us to better collaborate with physicians on medication adherence and really chronic disease that affect the elderly, diabetes, hypertension. I think this helps us be much better positioned to treat and care for those patients in that age group. And then when you combine that with a lot of the operational programs that we continue to develop and evolve, I think pharmacy has never been better positioned now to help care for all of our patients, but especially the elderly.
Yeah, and I'll pick up where Mike left there. So far during the vaccination program, I've noticed that the elderly have had a much easier time dealing with their local community pharmacies, getting an appointment, getting there, making sure the vaccine was done. It's convenient for them. They're comfortable with those pharmacists. They're comfortable with their local pharmacist. They're like family to them. You know, in my pharmacy in particular, we're only allowed to vaccinate 65 and older, people 65 and older. So all of those elderly people at this point are coming to our pharmacies and being taken care of. And for independent pharmacies, community pharmacies, they usually offer free delivery. So the patients do not have to leave their home for their medications. The collaborative management between doctors and pharmacists to treat patients or to monitor their drug therapy to make sure it's being effective. You know, these are all things that the elderly would benefit from more than anybody.